Good afternoon, everyone, and welcome. Thank you for allowing the time to wait for more people to join. Hopefully, we'll have more coming as the meeting progresses. My name is Alioune Sen. I'm the coordinator of the Fulbright program in West and Sub-Saharan Africa. I'm truly honored today to moderate the Fulbright Online Enrichment Seminar, which will be on reproductive health challenges in Africa and presented by Amatalla Saulawa from Nigeria. So, as Fulbright scholars, student researchers, and ETAs, uh, you guys are all engaged in some form of cross-cultural exchange and knowledge sharing. So what makes today's topic especially important is that reproductive health is not just a clinical issue. It is deeply connected to political, economic, cultural, and structural factors. So today's presentation is framed through the lens of reproductive justice, which is a framework developed by Sister Song, which broadens the discussion beyond access to healthcare. So it really questions whether women truly have autonomy, meaning the ability to have children, not to have children, and to parent children in safe and healthy communities. So that framing is very powerful because it really pushes us to think beyond just numbers and to try to consider systems. It really, in other words, it really pushes us to ask what structures enable people to make choices, what policies limit them, and what does justice actually look like in this context. So as you listen today, I invite you to think and try to make comparisons across regions, disciplines, and and also comparisons based on your own research experiences. So with that, I'm very pleased to introduce Amatalla Saulawa. And Amatalla, if you're ready, I'll turn it over to you. Um, if you, whenever you're ready, you can share your screen and go ahead with the presentation.
Okay, well, thank you so much. Let me go ahead and share my screen. I apologize for my voice. I got sick
No
um,
worries. Thank you.
over the weekend. But yes, thank you all. As he said, my name is Omotola Sola. I'm from Nigeria and I'm also have a project in Nigeria, and my presentation is going to be on reproductive health challenges in Africa as a whole. So, as a bit of an outline for what this presentation is going to contain, I'm going to begin by defining the problem, talking about why this matters, outlining potential solutions before concluding and providing references. So, let's begin by defining the problem. So, the problem is African women are not able to experience reproductive justice. So, you might be wondering, what is reproductive justice? Aliyah did a good job of summarizing what reproductive justice is, but it's basically a framework, a rights-based framework developed by Sister Song, which is an African American feminist organization that wanted to look beyond just my body, my choice framework to see what other choices are women able or unable to make when it comes to reproduction. So the framework is defined by the ability to maintain personal autonomy, the ability to choose whether to have children, the ability to choose whether to not have children, and the ability to parent those children in healthy and safe environments. So as this framework that it is, it encompasses a number of aspects of health. So obviously it encompasses maternal health, but it also encompasses menstrual health, urological health, and different aspects of women's existence. So when I say African women are not able to experience reproductive justice, I'm really focusing on four main aspects. So the first aspect is a lack of personal autonomy. So when we think of personal autonomy, it's not just being able to make specific choices, and lack of personal autonomy is not just, oh, my parents tell me to do XYZ, or I'm influenced by my religious leaders to do XYZ, but it's actually something that can affect people's health, and it can also it becomes a matter of life and death in certain situations. So when we think about this, one of the main ways that this lack of reproductive autonomy is shown is the fact that 144 million women and girls across Africa experience genital cutting, which opens them up to a lot of different negative reproductive health outcomes, whether that's infections, whether that's complications with pregnancy later in their life, or other different conditions that emanate from the fact that they were basically forced to undergo this procedure without knowing what it entails. And then also 41% of girls experience child marriage, which is obviously connected to economic conditions, but it also goes ahead and relates to different aspects of the reproductive justice, such as abortion rights. So if you're in a situation where a lot of young girls are getting married and they're getting pregnant and their bodies aren't capable of carrying a healthy pregnancy to term, one of the options would be to terminate the pregnancy for the sake of their health. But in these cases where most of African women live in countries where abortion rights are severely restricted, a lot of them talk about, like for example, Nigeria, it's only in the case of protecting the mother's health, but that's also a vague thing. Um, and it's not a widely agreed upon definition. So it means that a lot of times when girls or when women are in situations where they would need to terminate the pregnancy, they're unable to do so. And so this leads to negative maternal health outcomes, but it could also lead to unsafe abortions, which can also lead to death. So it's a situation where these things are mutually reinforcing, where you're in a a child marriage, and you're not able to get the full spectrum of reproductive health care if you were to have a negative birth outcome. And again, this is related to maternal health. 180,000 women on the continent die from birth yearly. And if we were to zoom in on a specific continent, Nigeria, or a specific country, Nigeria accounts for 28.5% of all maternal deaths in the world. So it's a very dire situation, and again, made dire even more than by the fact that they aren't able to access all reproductive health care. And then the last aspect of this definition is the ability to parent in safe communities, which is not the case for a lot of women and parents. So across the Sahel region, which spans from Senegal to Sudan, a lot of women are living in situations where there's a lot of insecurity, there's a lot of terrorist activity, there's a lot of banditry happening. And so even when this doesn't necessarily impact them directly, like maybe they don't live in a city or a village or something that's been impacted by this, the fact that it's happening does shape the type of healthcare they're able to access, even beyond just and losing doctors and other qualified medical professionals. It's leading to them being unable to access healthcare and their children being able to access healthcare. So again, these are just some of the ways that women aren't able to experience reproductive justice. So when we think of why this matters, obviously it should matter to everyone because it's an issue of health, but there's a lot of issues in the world, and sometimes once you understand the full complexity of it, it's easier to understand why this is such a pressing issue. So, of course, all of this emanates from the belief that healthcare is a human right guaranteed to all, which most people would agree to, and then specific reasons why this is such an important issue on the African continent. So, the first one is scale. Africa is a continent that's home to over 1 billion people, and obviously, a lot of those people are women. So 770 million of those people are women. And when we look at specific countries like Nigeria, um, half of the population is female. So we're looking at a population of 200 million. Around half, over 100 million people are women. And 63% of Nigerians live in multidimensional poverty, which means they can't necessarily pay their way out of these issues. And so understanding that type of scale makes um, makes us easier to see why this is such a pressing issue, because it um, affects a lot of people. And obviously, maternal health, reproductive health affects child health. So it's a reinforcing issue that um, affects generations after generations. So the next thing is the quality of life of people that they're able to experience. There's a saying that what doesn't kill you makes you stronger, but when it comes to reproductive and maternal health, that is not true. What doesn't kill you affects your disability adjusted life years. And so when we look at this, it doesn't just impact their whether they live or die, because there's some people who don't die during childbirth, but they still develop chronic conditions like fistula, um, or high blood pressure that affect their life condition in a lot of different ways years after they had the child. So that's one to think about. And again, going back to the broader continent, the life expectancy of an African woman is only 66 years old. And when we look specifically at Nigerian women, the life expectancy is only 64 years old compared to a life expectancy of 81 years for an American woman. Um, and obviously, there's a lot of different factors that contribute to life expectancy, but one of the main ones is the fact that we have such a high maternal mortality rate. Um, And then lastly, it's preventable. Although the situation is very dire, it's not primarily driven by genetics. It's not an innate situation where, this is just how the way things are, or, this is something that was determined as soon as the person's genetic code was written. It's preventable. We've seen countries reduce their maternal and child mortality rate, and so it's something that can be done, and this is something that should be done because we shouldn't have people dying for no reason. So, thinking about potential solutions, I wanted to look at this, which basically intersects the need for increased multi-sectoral funding with a rights-based approach. So, obviously, it's going to cost money. Like everything. But there's different ways in low cost manners that the situation can be improved. For example, you have midwives. So Africa is experiencing a really bad brain drain as the best doctors and other talent move to Western countries like the United States or the United Kingdom, Australia. But midwives are a way that this can be improved in a cost-effective manner. So midwives do not cost as much as doctors. Their education is also shorter than doctors. And although they have a more limited scope of practice, they can be taught to do certain things to kind of expand their scope of practice while also acknowledging the fact that there's some things that their training just can't allow them to do. And so that's one way that having trained birth personnel with every birth is a way for maternal health and maternal mortality to be increased, because a lot of the times the reason why the maternal death happens is because they weren't able to access healthcare in time, or they just didn't know that something was happening before it was too late. The next thing is reproductive health education. So, comprehensive health education that teaches people about different aspects of their health. Like, for example, what is birth control? How can I access birth control? What are condoms? How can I use condoms? What is abortion? How can I access abortion or perform an at-home abortion in a safe manner if that happens to be the case? And for people who do want to have children, it's important to teach them, okay, what are the warning signs of things like preeclampsia? When do I need to have um, a doctor or a medical professional come and intervene in my childbirth? So obviously this goes hand in hand with increased medical personnel, because you can know that something is going wrong, but if you don't have a midwife or someone attending the birth, then there's nothing you can do about it. And the last thing is safer communities, again, because sometimes people's access to medical professionals and medical care is shaped by the fact that they do not live in a safe community. I was reading recently in parts of northwestern Nigeria where medical professionals like doctors and nurses were being kidnapped for ransom in rural communities that really need these professionals the most. So if a doctor's safety isn't guaranteed, then they're obviously not going to practice there. There's a lot of places that want doctors, and it leads to negative health outcomes for the women there who are no longer have any choice. The next thing is enshrining these things in a rights-based approach. So looking at reproductive health not just as a health issue or a thing about policy, but a fundamental human rights. So one of the ways that this can be done is through anti-female genital mutilation legislation. Um, which is kind of a mixed situation on the continent. Recently, Gambia in February 2026 introduced legislation that would overturn their previous ban, and it's now at their Supreme Court on female genital mutilation. But previously in 2014, I believe they had banned it. So, um, again, there's a lot of push and pull where people are saying, no, this is our tradition, this is our culture, this is our religion, and people saying, well, this is a human rights violation at the same time. Um, so yeah, the next thing would be abortion rights, just so people can have the option to not have a pregnancy, because we've seen that in situations where abortion rights aren't legally enshrined, people turn to unsafe self-managed abortions, which can lead to other negative health outcomes. So women being able to terminate a pregnancy if they choose is an important part of maternal health. And then guaranteed health care, so people don't have to debate whether they should go and get, a routine checkup or get something to eat. There's been a situation in Nigeria, even though the births are increasing in many parts, women are not actually attending their appointments because they can't afford them. So making healthcare a fundamental human right and enacting legislation that would make it universal and have universal healthcare coverage is an important part of this. So I wanted to present this case study of midwives in Sierra Leone and what they were able to um, accomplish. So previously in the year 2000, Sierra Leone had the worst maternal mortality rate in the world, over 1,000. I believe the number was 1,600 something. Um, deaths per 100,000 lives. So that was really bad. And it was the case in Sierra Leone. And so they introduced a plan to improve their maternal health. And one of the things that they did was by increasing midwives. So another reason why midwives are so important, especially in the African continent, is that they have been historically and culturally a part of the birthing experience, even if they didn't experience or didn't undergo specific scientific training. Women are used to having midwives or their grandmother or their aunts or someone like that attend the birth with them and help them out. So using this model was culturally relevant and it really worked because in 2010 they had 100 and they have more than 1,000 now in 2023. And now their maternal mortality, while it's still high, it's really not that bad compared to what it was before. They reduced it by over 74%. So now it's only 443 per 100,000 live births. And obviously, that's not perfect, but it is something. And for someone whose project in is going to be in Nigeria, that's something that can be replicated because right now, Nigeria is around where Sierra Leone was before. It currently has one of the highest maternal mortality rates in the world of over 900 maternal deaths per 100,000 live births. So midwives are a way that this can be increased. They provide comfort, they provide science, they know what they're doing, they're experienced with births, and they can refer women to better or more sophisticated medical treatment if that's necessary. So, the only challenge with this is decreased funding. Obviously, all of us who have been anything global, but specifically global health, have seen shifts in the global health funding regime. Um, America has now backed out of the World Health Organization and cut a lot of the funding that we were previously giving through USAID. So that's the challenge in getting sustainable funding. But for now, this has really helped them decrease their maternal mortality, and it's something that can be replicated in similar countries like Nigeria. So this brings me to my conclusion. So I conclude with saying creating reproductively just environments is greatly necessary for the health of African women. And I would also add children because their health is also impacted by their mother's health. So with this, I want to end by saying that the status quo is not inevitable and it's not natural. It's not a given fact that we should just accept that millions of or hundreds of thousands of African women are going to die each year giving birth. Um, and it's a result of specific choices and policies. We have seen countries that have had a 78% reduction in maternal mortality by promoting policies that are just, that look at the political situation, the social situation of each country, um, and give, solutions that are tailored to their reality. And so we can do something about it. One ways is through midwife care, by increasing healthcare access, by promoting African women's rights, by, I don't know if my camera is going out, but I apologize if it is. Um, by, by making sure that abortion is a human right and is protected as such in the law, and also by making sure that every woman has universal health care. Um, I'm gonna turn off my camera because I think it might be glitching, but I'm not
That's
sure.
okay. That's okay. No.
So, okay. So that brings me to the end of my presentation. The next is just my sources. So I would love to answer any questions if you guys have any, or just any comments that you may have. Thank you.
Thank you so much, Amatala, for, this very thoughtful and powerful presentation. So to me, what really stands out is the way you shifted the conversation, from individual outcomes to really broader um, structural realities. You showed us that maternal mortality, child marriage, restrictive abortion laws, and FGMs are not isolated issues. They are connected and deeply influenced, by policy, funding, governance, and also instability. I really liked the fact that you put an emphasis, on the idea that the status quo is neither natural or unavoidable. That's something that's a very important reminder. When we see 180,000 maternal deaths each year, or when we think about how many women are affected by restrictive abortion laws, it can feel overwhelming. But your case study from Sierra Leone remind us that real change is achievable. So with that, I would like to open up the floor for anybody who has questions or comments. Questions or comments, guys? Okay, then maybe I can go first, if that's okay, Amatala.
No problem.
Okay, so you can correct me if I'm wrong, but from the way I understand it, you kind of frame this using reproductive justice, sorry, instead of just, reproductive health. So why is this distinction especially important in the African context?
Yeah, thank you. I think one of the reasons why it's important to me is noticed that a lot of conversations about reproductive health focus on either or. So for me, it's seen that, as you mentioned, like everything is connected. So one of the things that I've noticed is that when we talk about reproductive health, for example, there's a lot of NGOs right now or organizations that are whole or solely focused on, for example, abortion rights or getting
Mhm.
women birth control and
Mhm.
getting women birth control. And sometimes that might actually not necessarily be what the women want. Some women do want children.
Right.
And it's important to, acknowledge that, yes, a lot of women do need birth control, but also there are women who do also want to have children and should be supported in that. So I like the reproductive justice framework because it's not saying that we're anti-birth control or they're trying to replace us or stop us from having kids, but also it's not just saying that um, that's the only option that
Mhm.
women have. And so there was this researcher who was doing something, and she was saying how a lot of the way that access to birth control is measured does not actually take into account whether women actually wanted it or not. So I think for me, part of the way that part of reproductive choice for me is acknowledging all the choices that can be made. And so that can be having kids, and that cannot be also not having kids, while also acknowledging that sometimes the choice between having a kid, not having a kid, depends on broader frameworks and is also connected to different issues like maybe abortion rights, for
Mhm.
example. So, yes.
Thank you. Thank you for that beautiful answer. Um, okay, before I carry on, any questions, guys? Questions, comments? Don't be shy. Nothing yet? Okay, I'll carry on. Maybe you guys will join with the questions in a little bit. So, in your opinion, what is the most significant barrier to reproductive justice in the region right now? Would you say is it funding? um, governance, or maybe the instability going on in the region, or is there any other reason you could give right now?
Honestly, it's hard to say because I feel like it's just a little bit of everything. You know what I
Mm-hmm.
mean? I
Yeah,
think
right.
at the moment, yeah, funding has decreased, and that's limited the ability of what people are able to
Of
do.
course. Yeah.
Ability is definitely something too, but I think it all goes down to multidimensional poverty because that's what's creating the instability. That's the reason why a lot of people aren't able to access the health facilities and the quality of the health care that they need.
Mm-hmm.
So I think it would be funding and good funding that, tracks outcomes, make sure it's not being siphoned to
Mm-hmm.
other issues or something like that. But I would
Right.
say at that point, that's what it is, and being able to create scalable initiatives. So.
Okay. Yeah, not to forget legal frameworks too, you know. Um, okay, you spoke about something I found very interesting was the Sierra Leone midwife case, you know, which is I find it compelling. So, what lessons from that intervention can be applied to other African countries that you mentioned during your presentation, like Senegal, which is where I'm from, or Sudan, and what might not be, you know?
Yeah, I think I'm not as familiar with the situation in Senegal specifically, but I
Mm.
would say
Okay.
for like low resource environments like Sudan, which is
Hmm.
going through a civil war at the moment, I do think midwives can be replicated again because they don't need the full spectrum of tools or even length of education that a doctor would need. And there's also more of them than we have doctors. So currently Nigeria has, I think, half of what the World Health Organization says should be the number of doctors per 1,000 people, I believe.
Hmm.
So there's not that many,
Wow.
but when it comes to midwives, it's a shorter training length. They're more of them. I hate to say they're cheaper, but because of their shorter education, they don't have to be compensated as much as a doctor would be. So I think for places that are starting from like really bad situation, a midwife could be a place to scale up. And then obviously there comes a ceiling because midwives are not surgeons. They can't do complex um,
Of course, yeah.
obstetrical procedures and things like that. But um, for a beginning, for such people who are for countries that have like really negative situations, that can be a good beginning.
Hmm. Right, right. Thank you. Um, so you also, since we're still talking about it, you mentioned instability in the Sahel region, if I'm not mistaken. But could you explain how political instability directly impacts reproductive health outcomes?
Yeah, I would say there's a lot of very direct ways that their health is impacted. One of the
Mm-hmm.
things is when there's a lot of political instability in a region, one of the main places that that violence happens is on a woman's body. So you'll have a lot of cases of rape, sexual
Of
assault, and things
course.
like that.
Right,
And
right.
that in itself is a very direct way of how things like sex STIs, um, things like that can be transferred to women, pregnancies that they might not be equipped to handle. Another thing would be the attacks on infrastructure that happened. So during Boko
Mm-hmm.
Haram, a lot of hospitals were attacked during that time. A lot of doctors fled to different states and they didn't necessarily return afterwards. So that's one way that the very infrastructure is. And then there's a lot of fear around like leaving the house, things like that, accessing healthcare, would be it. And then when there's instability in a region, they also attack the livelihood of people. So I know in Nigeria, we have a lot of issues with farmers and herders. And so the farmers might not necessarily have access to their crops, which even if they move to a safe place, like they're moved to a um, sorry, an IDP camp. I forgot what it stands for, but an IDP camp inside of the country, but in a different place. They don't have access to their means of livelihood like before, so they're not able to pay for certain, health things like that. Like they're not able to pay for healthcare. So I would say it's a lot of different ways. Some of them are more direct than indirect, but at the end of the day, people aren't able to access healthcare like they previously would have been.
Mm-hmm.
And I saw I had a question in the chat that someone said, do you think framing it as reproductive justice may be incendiary in certain contexts and not all contexts. Um,
Oh, thank you. I didn't see the question. Yeah, go ahead.
yeah. I want to say I don't think so. I think maybe the justice part of it might be like people might think, okay, we're trying to do some radical whatever here. But I think reproductive justice really makes a lot of sense for most people because it's still saying like some people don't want children, you know? And that's okay, and that's something that should be protected, but also some people do want children, and that's also something that should be protected. I think in certain cases across the African continent, that can be radical because a lot of the initiatives are focused on either ending maternal health, which
Mhm.
doesn't necessarily mean like maternal mortality, sorry, which doesn't necessarily mean promoting more births, but just like preventing people who are um giving birth from dying, and then also birth control and like family planning and things like that. So I think maybe for those people who I know there's some people who say like we shouldn't be promoting, we should try and lower the birth rate because we don't have enough resources and things like that. But at the end of the day, some people are still going to have kids and people still want to have kids. So I think for me, it's not that inflammatory to say like we should do both. But I guess like for people who are anti-abortion, anti whatever, that can also be something like, no, we don't want people to have the option to terminate a pregnancy. But to me, I feel like it's the best case scenario because it's enshrining both people's rights, you know, to the right to have a child and right to not have a child. So it's not to me, but I'll be interested in if you have like specific context that you meant in particular.
Any other questions, guys, or comments? Okay, it's probably gonna be my last, or maybe I have another one after this one. But if if funding cuts keep on happening globally, what do you think is the best way, uh, or what do you what strategy do you think we could put in place to try and maintain maternal health progress?
Ooh, this is a good one because I feel like
Mm,
ooh, the level of things that were being subsidized, the amount of things that were being subsidized by USAID, I feel like I continue to learn more about it because a lot of things are subsidized by outside funding.
mm-hmm,
So I think the shift should be when it comes to medicine. I've seen like a lot of countries, like even South Africa, think more about producing their own things, like specifically with COVID, producing their own COVID vaccines, producing their own medications. That way you don't have to rely on outside companies that may be more expensive. Um, and then also you have your own indigenous solution to those problems. So I think we'll see like we should see a turn inward in a sense. When it comes to infrastructure and things like that, that's where the decreased funding is going to be really bad because we don't have like a lot of existing infrastructure or hospitals to begin with, much less to say, oh, we can just preserve what we have. Um, and again, I think for me, the turn is always going to happen to scaling up but scaling down. So in the sense of having more people who have less skills, but have basic skills that can prevent certain birth outcomes, because um, certain birth outcomes, like for example, high preeclampsia, high blood pressure, those things can be monitored. The signs of that are very obvious. And those are something that you might not necessarily need, you know, a high skilled person there to do. Something like fistula, which was what my Fulbright proposed research was on, um, is again something where it's all about prolonged obstructed labor. There are things you can do to make sure that that's not the case, and it doesn't necessarily require a surgeon. Um, to take care of that, but it does need a medical professional. So I would say having more lower skilled things will help us decrease or at least maintain the level that we're at now without getting too much. But I don't know. I feel like we have to diversify funding sources as well. So it's definitely a negative situation, but I think that's what the turn is going to be right now because after the United States pulled out, a lot of different countries also pulled out. So that's something we
Right.
have to.
Right. Thank you for that. Very good answer. And from the question you had before, my last question, I don't know if you saw it, but I think it's Abani. They were saying that they meant in certain context, not all context. I don't know if you want to touch on that again or.
Okay, yeah, I can see like in certain contexts, different parts of it being problematic. I can see the justice thing being like, okay, these activists are coming up. Um, Okay, I saw what they said. Thank you. The term reproductive justice can carry strong political associations for some audiences, even though at its core it's rooted in public health, human rights, and equity. If the goal is to keep the substance but reduce perceived polarization, maybe it can be reframed where it emphasizes health systems equity and autonomy rather than ideology, like reproductive health equity. Yeah, I can definitely see that. I think the thing is like this is a specific definition defined by them. So this specific framework that they've created. So I think when we use the framework, it might be hard to like kind of divorce it and be like, this is reproductive health equity because this is what this specific organization has defined. But I
Right.
can definitely see myself saying, okay, reproductive health equity, part of it does include XYZ and the third as defined by Sister Song, um, while still maintaining the justice part of it. Um, so yeah, I understand what you mean, especially now that we're in a more polarized political environment. Saying anything with justice can be like, oh, social justice warrior, whatever. They're trying to wokeify health. I don't know, something like that. But I think at its core, it's a good definition because again, it enshrines people's ability to have kids, not have them, but also have them in safe communities. And I think, on both sides, we have to acknowledge that sometimes you want a kid, sometimes you don't. So I would say, yeah, I think definitely the language can be tweaked, like maybe reproductive health equity if you're talking to people who would not be the most receptive to that. But yeah, thank
Yeah. So I'm just gonna bounce off what you just said, and as we're nearing the end of our time, I just want to reflect on something that feels central to today's conversation. So we often talk about reproductive health in terms of mortality, but reproductive justice really invites us to think about dignity, autonomy, and safety. So it really asks whether one can make decisions about their bodies in stable and supportive environments. It also really encourages to view research not just as detached observation, but as a tool that shapes policy. As we finish, like I said, I just want to highlight a key point from today. The current situation is not unavoidable. It really stems from specific policy choices, funding priorities, and governance decisions, which is why I asked the question I asked earlier, and that shows that change is possible. And Amatala, the Sierra Leone case example you gave really shows that when investment, training, and political will come together, results can improve significantly. Because a 78% reduction in maternal mortality is not just symbolic, it means lives saved, families kept together, and futures secured. Reproductive justice relates to health systems, gender norms, economics, conflict studies, law, and education. So I really hope this conversation continues well into everyone's research, classrooms, collaborations, and even, potential future policy making efforts. Who knows? So thank you again, Amatala, for sharing your expertise and perspective. And thank you all for your presence today and your thoughtful engagement. So, Amatala, I don't know if you want to add something else before we wrap up.
No, yeah, I was gonna say thank you so much for attending my presentation and listening. And if you have any questions, feel free to contact me afterwards. So
All right, sounds good. Thank you, guys. Thank you very much. I'm wishing you all a wonderful rest of the day and have a nice weekend.
Thank you.
Bye.